Hey guys, welcome back to my channel. I'm Zindi, your pharmacist, and this is Health Talk TT. Now, before we start, if you have not liked or subscribed to this channel, I'll give you a few moments to just quickly go do that and come back. Alright, so we can start now. Today we're going to continue with managing comorbidities during the COVID crisis, and we want to talk about hypertension today. Now, hypertension is high blood pressure. It's an elevated blood pressure level. And when you get the high number, that's your red flag. It's not just a number that you could get and then put in the back of your mind. It's a number that tells you that your cells are not getting enough oxygen, that the pressure at which your blood is flowing through your blood vessels is too high. It tells you that your heart is working overtime and it's probably weak at this point. That's what that number tells you. So hypertension should never be taken lightly. Now, in the midst of the coronavirus, your risk is increased if you are a hypertensive patient. And you may have been hearing that here and there. Persons have been saying it. You may not understand why or exactly why your hypertension diagnosis puts you more at risk. Now, honestly, your risk is threefold. One, you are more at risk for contracting COVID-19. You are more at risk for having more severe symptoms. And you're also more at risk for, unfortunately, dying from the infection. And I'll explain to you exactly why. So, just glancing at my notes here. Now, hypertension has been, since the onset of the pandemic, it has been the most common comorbidity associated with persons who also have coronavirus. In China, up to 22% of their confirmed cases for coronavirus were also persons living with hypertension. And in Italy, 76% of persons who passed from coronavirus were also hypertensive. Now, of course, Italy has a large aging population, so you see where their geriatric population clashed with their hypertensive population. So it's like a risk compounding a risk. And that is why we need to know the information that is associated with hypertension so that you could reduce your risks as much as possible. How are you at risk? Number one, the health of your heart. If you have hypertension, as I mentioned before, that red flag, that high number, says that your heart has been working overtime. Now, just like everything else that ages, your heart and every other organ and system in your body ages as well. So over a prolonged period of time of working overtime, because it had to compensate for what your body could not do, you have a weak heart. And with a new virus probably threatening to enter into your body, you need a healthy heart. And as a hypertensive patient, you don't have a healthy heart. Number two, your risk, age. As I mentioned before, it's almost as if there's one risk factor compounding another, because most patients who are hypertensive are also older in age. Hypertension is usually a disease, a non-communicable disease that occurs in the older age patients. Not saying that younger persons don't suffer with hypertension, but majority are older patients. And then lastly, the risk is that your immune system is also weakened. Remember, your immune system has been fighting to keep you during your how much of a years of hypertension diagnosis. And now it too, as you have aged, as you have been dealing with hypertension over a prolonged period of time, your immune system is also weak, and therefore your defenses are not fully capable to act the way a healthy body would. So this is why you are at risk. Now, what are some of the tips that I want to share with you today on how to best manage it at home? Number one, so important, you have to change what you eat. Yes, hypertension has a genetic predisposition, but it is hugely dependent on what you eat and what you do. It is what we like to call a lifestyle disease. So I am suggesting that you change what you eat and that you adopt the DASH diet, which is dietary approaches to stopping hypertension. DASH. It is a high fruit, high vegetable diet, less fat, less dairy diet. You want to really focus on getting as much good, healthy, hearty, local food into your diet as possible. Number 2, I want you to test your blood pressure as often as you can. So if you don't have a machine, you have to get a machine or at least get access to one. And then you can test as often as possible. Take note of your number, because knowing your number dictates how well you can manage or how well you have been managing your blood pressure readings. Number 3, I want you to increase your physical activity. I know if you watched my last video, I spoke about physical activity for diabetes as well. And I'm also telling you, as a hypertensive patient, getting physically active is key. Especially if you're doing cardio exercises, it's going to help strengthen your heart. And your heart is going to need all the help it could possibly get. Number 4, I want you to consume less alcohol. I fully understand what I'm telling you here. For females, it's 1 glass or less per day, and for males, 2 glasses or less. Now, alcohol increases your blood pressure. Either it could sustain it over a long period of time if you've been a chronic alcohol drinker, or even if you socially drink, but for that time you binge, meaning you have a large amount, it could spike your blood pressure and then keep it high. And during this time, we want to keep it as managed as possible. And lastly, I want you to reduce your stress. When your body engages with a stressful environment, is exposed to a stressful situation, your body sends out hormones, and these hormones increase your heart rate, so your heart is beating faster. Your heart that's already weak is beating faster, and then your blood vessels, they shrink, they constrict, they reduce in size. So now the space through which your blood would flow, say it's normally this, has now been constricted to this, a smaller space but the same amount of blood. So your blood pressure, what happens it spikes up. So that's why I want to encourage you to choose to deal with your stressful situations differently. I know the headlines could be stressful. The fact that you might be home and not working may be stressful. Having your children at home may be stressful. Not knowing where your next meal may come from is also an added stress. But you must decide that your health is important and make decisions to reduce your stress, whether it means walking away and taking some deep breaths, saying a prayer, meditating, lying down for a while, taking a nap, listening to some meditating music, whatever it may be, you have to reduce your stress. So these are my 5 tips. Thank you so much for joining me here today at Health Talk TT. I want to remind you to like and share the video, subscribe to the channel, and put on your notification bell so you know whenever I post videos. I want to also send you over to Nalis's Facebook page, because I also do videos for them every Tuesday, just short health tips. If you don't have time to listen to these discussion type videos, you could always check me out at Nalis's Facebook page. Thank you to every single person who has liked and shared these videos and subscribed to my channel. I know it's a new channel and I am grateful for your support. I have just given you the blocks. I want you to go and build a better you.